Welcome to Undocumented and Uninsured, where we break down the intersection of immigration law and healthcare access in the U.S. Thank you for joining us today, in this morning, evening, or noon, wherever you are. I hope you have an amazing day. I'm Naomi Aguirre, and today we're tackling a critical question. How do U.S. immigration laws impact access to healthcare for undocumented immigrants? Today, we'll explore key laws and hear real stories from undocumented individuals and discuss the legal and ethical challenges of denying healthcare based on immigration status. But first, a quick word from our sponsor. This episode is brought to you by Legal Shield. Need affordable legal help but don't know where to start? Legal Shield provides access to experienced attorneys for immigration, healthcare, and other legal issues without the hefty price tag. Whether you need advice on your rights or help navigating complicated paperwork, they've got you covered. Visit www.legalshield.com and use the code HEALTHLAW for a free consultation today. The legal landscape. To understand the barriers to healthcare for undocumented immigrants, we need to look at the laws that shape access. Let's start with the Emergency Medical Treatment and Labor Act, or EMTLA. Passed in 1986. EMTLA requires hospitals to provide emergency medical care to anyone, regardless of their ability to pay or their immigration status. Sounds great, right? Well, the catch is that EMTLA only covers emergency situations. It doesn't guarantee follow-up care, routine checkups, or treatment for chronic conditions. Then there's the Affordable Care Act, or ACA, which explicitly excludes undocumented immigrants from accessing federally funded health insurance programs like Medicaid and market subsidized, which means millions of undocumented people are left without affordable health care options. Another important law to note is HIPAA, the Health Insurance Portability and Accountability Act. HIPAA protects the privacy of your medical records and limits what healthcare providers can share, even with the government agencies. This is especially important for undocumented patients who might fear that going to a doctor could expose them to immigration enforcement. While HIPAA is meant to keep that information private, the fear still keeps many immigrants from seeking care, especially in states with strict immigration laws or aggressive enforcement. Meanwhile, state policies vary widely. Take California, for example, which offers expanded Medicaid access to certain undocumented populations, versus Texas, where access is far more restricted. This patchwork system leaves many immigrants struggling to find consistent care. The reality on the ground. So what does this actually mean for undocumented immigrants, you may ask? For many, the lack of insurance means that they rely on community clinics, which are often underfunded and overburdened. Others delay seeking care until the minor issue turns into a massive one, at which point hospitals must treat them under the EMTLA Act, but they may still face massive medical bills afterward, and nobody likes big bills. And sometimes, even when life is on the line, the system fails them. Take the case of Montejo versus Martin Memorial Medical Center. In this case, Luis Montejo, an undocumented immigrant who was seriously injured in a car crash, received emergency care in Florida. But once he was stabilized, the hospital arranged to have him forcefully deported to Guatemala without his consent, even though he still needed long-term care. Montejo sued the hospital, claiming false imprisonment and negligence. Even though the hospital argued that they were acting in the interests of his health and safety, the case revealed how immigration status can be used to deny continued medical care and even basic dignity. Situations like these highlight a harsh reality. Healthcare in the U.S. is often tied to legal status, leaving many undocumented immigrants in a medical and financial limbo. The ethics of healthcare access. This raises a big ethical question. Should healthcare be a human right? Public health experts argue that excluding undocumented immigrants from regular healthcare isn't just a humanitarian issue. It is a public health risk. Preventive care reduces disease spread, lowers emergency room costs, and improves overall community health. On the flip side, opponents argue that offering healthcare to undocumented immigrants places financial strain on the system and may encourage more immigration. But is that really the case? I don't think so. Studies show that undocumented immigrants contribute billions in taxes. Many even pay into Social Security without ever receiving benefits. So are we actually saving money by restricting healthcare, or are we just creating a bigger, costlier problem? Policy solutions and the future. Some states are expanding healthcare access for undocumented immigrants, while others are doubling down on restrictions. Could there be a federal solution? Some proposals suggest allowing an undocumented immigrant to buy into the ACA marketplace without subsidy. Others advocate for expanding state-funded Medicaid programs. At the end of the day, this debate isn't just about policy. It's about people. It's about access to life-saving treatment and whether our laws reflect our values. What do you think? Should the U.S. expand healthcare access to undocumented immigrants? Let us know by joining the conversation on social media by using hashtag undocumented and uninsured. That's it for today's episode of Undocumented and Uninsured. If you found this discussion informative, please subscribe and leave a review. And if you want to dive deeper into the immigration healthcare, check out the resources in the episode description. Thanks for listening. See you next time.